So now it's my great pleasure and honor to introduce Maureen Watt, who is Minister for Public Health in Scotland. Maureen has been a member of the Scottish Parliament since 2006 and held previous positions as Minister for Schools and Skills, convener of the Rural Affairs and Environment Committee and Infrastructure and Capital Investment Committee. She was appointed Minister for Public Health in First Minister Nicola Sturgeon's first government and is now serving under Shona Robinson for the Cabinet Secretary for Health, Wellbeing, Sport. Maureen, please come to the stage.
Well, good morning, ladies and gentlemen, and I'd like to thank you, Terco, President of the European Organisation for Rare Diseases, and Jan Lecam, Chief Executive Officer, for inviting me here today as you gather to discuss rare diseases and bringing with you huge amounts of expertise and experience. This is the 8th European Conference on Rare Diseases and Orphan Products, and it's being held in the UK for the first time. It's a particular pleasure that you chose to come to Scotland and to our beautiful capital city, Edinburgh. We are both honoured and delighted. So on behalf of the Scottish Government and the Scottish people, I extend to you a very warm welcome. I hope that some of you will be able to enjoy at least a few of our wonderful, historic and beautiful sites here in Edinburgh and perhaps further afield. I hope perhaps some of you have added some days to your stay to explore Scotland outside Edinburgh, and if not, that your appetite has been whetted for Scotland so that you are aroused to make a return visit, perhaps for a longer time. Mr. President, Scottish Government ministers fully support the vital work of Rare Disease UK, Genetic Alliance UK, and our other European partners and stakeholders, including, but not only, those represented here. I'm also glad to see people who live with rare diseases with us. They are at the centre of all we do. Indeed, patients and their families who share their experiences of living with rare diseases are vital if we are to raise awareness and shape improvements in diagnosis, in treatment, in research, as well as in experiences of care. We are determined to improve how we help people with rare diseases, whether that is through enhancing all the relevant NHS services across primary, community and specialist care, or importantly for many people with rare conditions, seamless links with social care. That is an area where we are making significant changes through integration of health and social care here in Scotland. I'd like to touch on some of the important work underway here in Scotland to help people living with a rare disease. The UK Rare Disease Strategy of 2013 required the 4 UK countries to develop individual implementation plans. And in July 2014, Scotland became the first UK country to publish its implementation plan, called It's Not Rare to Have a Rare Disease. The title is a powerful and meaningful one, reminding us that rare diseases, although often rare in terms of the number of people living with a specific disease, it's estimated to affect around 300,000 people in Scotland over their lifetime. Extrapolate that across the UK and across Europe. This is a hugely significant number. If we are to make inroads, we want to see that people and families affected by rare conditions get what they need. We want to ensure that people with rare diseases are able to access the best possible healthcare services. Therefore, our key aims are to improve diagnosis, equity of access, coordinated service provision, and to facilitate research. Our fundamental principle is putting the views and needs of patients at the centre of all we do. This means not only asking, "What's the matter with you?" but what matters to you. We aim to ensure people are involved in and can shape their care. They must be able to make informed choices with on-hand support for them and their families and carers. As outlined in the first biennial report from the Rare Disease Stakeholder Forum, published in February, significant work has already been done to address the recommendations in the UK strategy for rare diseases. And I'd like to commend Alistair Kent and members of the UK Rare Disease Stakeholder Forum for their work in achieving so much already. But I must also recognise the care and support provided by the health and social care professionals, researchers and patients and carers, without whom the strides that have been taken would not have been possible. I also applaud the strong partnership working across all 4 UK countries, which allows us to share best practice and deliver coordinated specialist services in our quest for continuous improvement and safe, effective and person-centred healthcare. Of course, I also want to celebrate progress being made here in Scotland. Our overarching implementation group includes clinicians, patients and patient groups, including Genetic Alliance UK. Dr. Aileen Cale, Director of our Innovative Healthcare Delivery Programme, and colleagues are developing a Scottish Cancer Intelligence Framework to bring data to clinicians and patients throughout their care pathway as close to real-time as possible. Some cancers are by their nature rare diseases, but we're not stopping here. We're clear that we need to bring the same innovation approach to rare diseases, and work on that is just beginning. I look forward to seeing this programme developing further, as I'm sure that not only is such innovation an exciting opportunity, but that it is also potentially transformational for clinicians and patients. In Scotland, we have a range of what we call national managed clinical and diagnostic networks working in a range of rare disease areas. All now have dedicated websites for use by patients and clinicians who can see at a glance advice, support and referral arrangements for all services, and indeed for those highly specialised services provided in England only, but on behalf of the whole UK. We have also reviewed the input of diagnostic specialities to rare disease diagnosis, with a long-term goal to develop more patient pathways for specific diseases. And in Dundee, here in Scotland, virtual clinics for photosensitive skin disorders are planned to allow expert staff in the specialist service to provide clinics remotely, reducing the need for patients to travel. Indeed, just this week, one of the programmes on Radio Scotland dedicated some time to highlighting photosensitive skin disorders, and it's so important that the wider public are made aware of the special requirements of some individuals with conditions such as these. On the 1st of March 2016, we marked the annual Rare Disease Day in Scotland with an announcement about the game-changing establishment of the Scottish Genomes Partnership. The Scottish Government and the Medical Research Council are investing £4 million and £2 million respectively in this partnership, which is a collaboration between Scottish universities and the NHS Scotland Genetics Services, which builds on £15 million of investment in the whole genome sequencing technologies by the universities of Edinburgh and Glasgow. Importantly, this initiative will develop genomic medicine, research and commercial opportunities in Scotland, and a Scottish partnership with Genomics England on genomic sequencing of rare disease patients in Scotland. By knowing the whole genome sequence, it may be possible to offer a diagnosis where there hasn't been one before, understand better the cause of the disease, and work out how best it might be managed. This knowledge may also point the way to new treatments. The introduction of this programme is a major step forward that can be of real potential benefit to people in Scotland and beyond. Ladies and gentlemen, I think this area of research is so exciting and it offers so many possibilities for individualised treatments and care. So in conclusion, looking after people in a safe, caring and respectful way remains the core purpose of our health and social care services. It builds on our 2020 vision for healthcare, ensuring patients have a stronger voice, not only in their own care, but in the planning and delivery of health and social care services. It is vital that our countries continue to work together to help improve the lives of the 30 million Europeans living with a rare disease. We are taking significant strides aimed at improving the experience of patients with rare conditions and their families. But there is always more that can be done, and we will continue to look at ways of improving our support and care for people with rare diseases. I am confident that all of you here will help to raise awareness and enhance the vital work underway across Europe to promote research and improve the diagnostics, treatment and quality of life for patients. Collaborating together, we can change the future. I hope you enjoy the rest of your conference and your time here in Scotland, and thank you very much for listening.